The RIDE program has been very exciting to be a part of for me. It's probably the most exciting thing I've done.
RIDE to me kicked off my growth to becoming a dentist.
I feel like it allowed me the opportunity to go back to my community, which is my goal.
Without the RIDE program, I don't think I would be the provider that I am today.
RIDE stands for Regional Initiatives in Dental Education.
RIDE is a mission-driven program. It is to distribute the workforce to rural and underserved areas. And we had 40 years worth of a successful program in the medical school of putting out physicians into the other areas, the rural areas and underserved areas.
The program is important to the state as a whole because we placed a number of highly qualified young dentists in rural and underserved communities and in community health centers.
We're spending a lot of time with them on what kind of factors happen in the rural settings, what kind of patients they might see, learning about cultural competence, improving their cultural awareness to work with a lot of different groups, also to work with a lot of different underserved groups.
They understand the mission, they understand the need, and they're inspired to go back and serve the communities they come from.
If you train people where you want them to practice, they're more likely to return to those areas. So if you're training everyone in Seattle, chances are they're going to stay in Seattle. But if we train them rural, underserved areas, they're going to look at those, they're going to think, maybe that's what I want to do.
And currently we have over 75% of our graduates are now practicing in rural and underserved areas. The most different thing about a dental student going through the RIDE program is that they spend their first years in Spokane, Washington, instead of on our Seattle campus. We have a regional campus at Eastern Washington University in Spokane. They spend their first years there taking kind of the basic classes, the basic dental classes, the basic science classes. Then they all come back to Seattle and do their third and part of their fourth year in Seattle.
The RIDE curriculum is equivalent to the Seattle curriculum. We spent a lot of time of our faculty in guaranteeing that.
We have nearly a one-on-one ratio between faculty and students in laboratory sessions. We have a cohesive small cohort that work really well together.
They were able to see us in our classroom and we were able to see them. Not just that, but we were able to do group discussions with them as well as group presentations. It's pretty much the same thing as a classroom. It's just that you're kind of doing this screen with a screen.
Our first year of dental school, we have the opportunity to go to a community clinic and work basically as a dental assistant, learning how to answer phones and schedule, placing rubber dams, doing cleanings on kids.
And one of the added bonuses to being in the RIDE program is we also have you taking x-rays, giving local anesthetic, taking impressions, and really becoming part of a dental team.
To bring everything back around from learning a bunch of didactic information in a lecture to putting it all together into something where you can change somebody and apply all your knowledge and skills and even challenge some of your skills to make you better. Kind
of going into the east side of Washington, the best type of care that the population can receive is at the community clinics. That's most affordable. So just kind of throwing you into that environment and getting familiar with that is crucial, especially going back to your fourth year when you do the 5 months there, your 5 months rotation.
What makes a 5-month rotation much deeper and more enriching than a 4 or 5 week rotation is that you really get to see outcomes. There are a lot of dental procedures where 4 and 5 weeks doesn't give you enough time to see the outcome. You don't see what you did had a positive effect for the patients.
We have community health centers in rural Washington state now completely run by RIDE students.
That's been the case in WWAMI for a long time, that the people training the medical students now were WWAMI physicians trained long ago. Now, because we've been around long enough, we're starting to see the same thing, and we're really excited to have our alumni as our faculty and as our leaders in the communities.
This year was my first year having a fourth-year ride student in my clinic. I grew up in Okanagan. I grew up in the surrounding area. I know how important it is to have access to care. It was very important for me to return to help out to a community that raised me, built me into the person I am today.
When you practice dentistry in an urban setting, you make a big impact. You make a big impact on your patients, you can, on your individual patients. But when you practice in a rural or underserved setting, you impact the whole community. That's really special.
It means a lot, just even in terms of helping me, carry on my goal and going back to my community. That's something that is kind of like a goal / a dream that I've been wanting to accomplish for my whole life.
I just felt like it was in line with my goals and mission in life, and so coming from the Yakima Indian Reservation, that's where I decided I needed to be in the RIDE program.
This program plants a seed for service that grows beyond graduation. These students are going out, learning, they're getting excited about doing these things and then staying in and taking care of our communities, which is wonderful.
If you're committed to community health, you're committed to providing services for those who may not have access, you're committed to understanding why and how we can make the lives of our patients better, this is a program for you.
It's been an overwhelming success. It's wonderful to sit on this end of it and say, all of our hard work paid off and is continuing to pay off.
To see that what skill you're developing is actually going to contribute to somebody's health, that they appreciate it, they've not had an opportunity to have that before, that is so rewarding and so reinforcing. I think it's very important for students to have that experience early, and so that embeds in their mind the notion of, wow, this is why I went into dentistry, to help people.